I lost a bunch of weight and went from this to this because I went through this and also went through this. But was it worth it? Hello everyone, welcome back to my channel. As you may know, I went through a 100+ pound weight loss, and a question I get a lot is, did I have weight loss surgery to help me lose that weight? The answer is no, I did not have any kind of weight loss surgery, but I did get surgery after my weight loss. So whether you want to call it a tummy tuck, excess skin removal surgery, a mommy makeover, whatever term you want to use, I had excess skin surgically removed from my body. So I'm going to tell you the story of what happened. I'm going to give you details of the surgery. I am going to share both the good and the bad, and what my recovery was like, what parts of my body I did get surgery on, what parts I chose not to, and why. My advice to you if you are thinking about getting a surgery like this, and whether or not I thought it was all worth it in the end. So I decided that I wanted to get the excess skin on my stomach surgically removed after I had lost about 80 pounds. I wanted to do this because while I was feeling more confident with my weight loss, I had so much extra skin on my stomach that was messing with my confidence. Things like putting on a pair of jeans and being able to button them, but like the skin getting in the way, or like wearing a form-fitting dress and I have this bump, but the bump's not fat, it's skin. Just things like that that were really messing with my confidence. And I was like, you know what? I've done all this hard work to lose this weight naturally, and I want it to look the way I want it to look, and I want to feel confident, and this skin for me is just really getting in the way. So I had excess skin on my stomach. I have excess skin on my arms and on my legs. I lived in Arizona at the time, so I went to Tucson, Arizona to meet with a plastic surgeon. I told him about my weight loss, told him about what I was insecure about and what I wanted to fix, and was totally open to his recommendations. And of course, he was like, oh, yeah, we can take the skin off of your stomach, we can take it off of your arms, we can take it off of your legs, we can do a breast augmentation, all this stuff. So after talking to him about all of my options, what I felt right for me was, number one, definitely taking off the excess skin on my stomach. That was the number one thing that bothered me. And while I was under anyway, I did go ahead and decide to get a breast augmentation as well, just because whenever you are shrinking, everything shrinks in proportion. And I was not used to that new chest size, and I wanted it to be what it was before. I decided not to do the excess skin removal on my arms and legs, simply because that was a lot of places to have to heal at the same time. I figured if my whole midsection was going to be healing, I at least wanted to be able to use my arms and legs freely, and the excess skin on my arms and legs didn't bother me as much as my stomach. The surgeon also told me what he could do was sew, I don't know the medical term, but sew back together my abdominal wall from being pregnant. And this is super common from being pregnant. The baby pushes in your midsection, and so your abs kind of split and then they stay that way. And he's like, while I'm in there anyway, I can go ahead and just sew that back together. And I was like, yeah, sure. So there was some surgery on the muscle there too. Again, nothing weight loss related, but just sewing those muscles back together and then cutting off the excess skin. So I go in for the surgery. I'm feeling very confident about it. I have full trust in this doctor and in his team. And so he takes me back to the operating room, and I'm all hooked up, anesthesia and everything. And he's like, all right, go ahead and count backwards from 10. So I'm like 10, 9, 8, 7. And I remember hearing, like, in movies, most people are like 10, 9, and they like pass out. And I made it all the way down to 1 and then 0, and I was like still awake and not drowsy at all. And he was like, that's interesting. And then one of his assistants was like, oh, this hose is kinked, and unkinked it. And that's the last thing I heard before I passed out. So
I guess there was a kink in whatever hose or something that was supposed to be supplying me with whatever anesthesia. Not sure how that works. I just remember that's what I heard, and then I was out. So then I am woken up from the surgery. I have a nurse kind of like pushing on my shoulder, saying to wake up. I heard somebody say she's not breathing. And I remember trying to open my eyes, and I couldn't open my eyes for whatever reason. It's like they were so heavy. My body was just not letting me open them. So I can hear everybody, but I cannot open my eyes to like look at them or make eye contact. But I just remember somebody saying she's not breathing, and then all of a sudden they like shoved this tube down my throat, and then I was breathing on my own, I guess. I'm still very out of it at this point. Um, and I just remember I had a tube down my throat, and I was just kind of like laying there for a while. And um, after like maybe 5 minutes of just laying there, the nurse was like, okay, we're going to call your husband and have him come pick you up. And I'm like, right now? But I just woke up. Like, I don't get to chill here for the day. Like, that wasn't really explained to me how quick they were going to get me out of there. So she's like, yeah, I called your husband. He's on his way to come get you. And she's like, you need to eat something. And I remember she gave me a bite of applesauce and was like, okay, that's good. And so I don't know what the point of that was. But anyway, I remember finally being able to open my eyes and looking down, and I'm just covered in bandages everywhere, like all over. I'm just covered in bandages. And we were staying in a hotel because we didn't live in Tucson, but we had a follow up appointment the next day with the surgeon. So we wanted to be close, obviously, in case there was any kind of complications. So they put clothes on me, and my husband came, Steve, and they had a wheelchair, and they're like, okay, you can get up and go now. And I have been awake for maybe 30 minutes, which I don't think is right. But for whatever reason, they wanted me out of there like ASAP. So I remember they were like, okay, get up. And I'm like, I can't. Like, I could not get up. Like, I couldn't sit up. And so these nurses had to like put their hands behind me and sit me up, and then go and put me in this wheelchair. And then my husband could take me to the hotel room. So I remember getting in the wheelchair. I remember being in a lot of pain, a lot of pain. And they gave me my painkillers to take with me to the hotel room and said I could take it like once I got there. So I get in the truck. I don't even remember how I got into the truck. Somebody must have had to have lifted me in the truck because I certainly wasn't walking at this point. So my husband drives me to our hotel, and we don't have a wheelchair or anything. And what the doctor had said is, she's not going to be able to stand up straight because they take your skin and they pull it down and cut it off and sew it back together. And it was 6 pounds, by the way, 6 pounds of excess skin he took off of my stomach. So you're like hunched over. But I was like, one, I was not fully awake. I was not fully coherent. I was in so much pain, and I just couldn't walk yet. So I remember my husband had to go ask the front desk of the hotel if they had a chair with wheels that he could just borrow. So he had to take it out to the truck, get me in the chair, and like wheel me in to the hotel room and take the elevator and go up. And all I wanted to do was lay down and go to bed. So I lay down, I went to sleep, and then I woke up in the worst pain of my life. Everything hurt, and I felt like the bandages were so tight I couldn't breathe. So Steve had to loosen the bandages. I was crying. I was taking pain medicine. Like it, I'm just being honest with you guys. It was horrible that first day. Horrible. Now, I will say that that is not the case for everybody. So I don't want that to scare you or to put you off from the surgery at all, because while I had a very difficult time, which I will continue to get into, I had a friend who got the same surgery as me who had a much easier time. So I don't want that to derail you, but I just wanted to share my story. So I'm in a lot of pain. We have the follow up appointment the next day. I still am not really able to walk. Like, I can stand, but the thing is, I can't go from laying down to sitting up or from sitting up to laying down on my own. Like Steve had to push me up to get me up or to lay down. Like I didn't really have that ab control. So he would have to put his hands on my back and I'd have to completely go limp and he would have to like lower me back down to lay down. And I was like that for about a week. But this is now the day after my surgery. And if I'm standing, I'm good. I can walk like all hunched over and everything, but I can walk. So I go to my appointment. The doctor's like, "How you're feeling?" I'm feeling awful. And he's like, "All right, take the pain medicine and you can go home and we'll see you for your follow up." So I'm like, okay. I also had these tubes sticking out of me, like these drains on both of my sides because the scar goes from like one hip to the other. And that's just to help fluids. And I am not someone who is good with blood or fluids. And the doctor's like, "Yeah, these little, like, I don't know, bags like attached to the tubes are going to fill up with fluid. You need to drain them and put them back on and clean them." And I'm like, absolutely freaking not. I will not do that. Steve will do that. So shout out to my super amazing, loving husband who helped me so much. I will say, if you are thinking about doing this surgery, make sure you have a person or two that you can really depend on for help because you are going to need it. So anyway, we drive home and the doctor says the following day you can go ahead and take a shower. So I'm like, great. So the following day, Steve props me up out of bed and he's taking off the bandages for the first time, takes off my stomach bandage, and my belly button, which is new, by the way, it's not your original belly button, they make you a new one, is crooked, like off to the side significantly. So I freak out because I'm like, oh my God, what happened? Like, why would you leave it like this? So I am freaking out. And Steve calls the doctor and I'm talking to him and I'm like, I'm just so emotional about it because this is an expensive surgery. And basically, the doctor's like, "Don't worry about it. I'll look at it at your follow up appointment in a week and we'll see if we need to do anything." So I am so upset and I'm just crying in the shower and I can't stand in the shower. So I'm sitting in a chair and I can't even wash my body because I don't want to touch my scar because I'm a giant baby. And so Steve is like washing me in the shower and I'm just crying and it was a whole mess. But we get me all clean, and a week later I go to my follow-up appointment and I'm like, "You need to fix this." And the doctor tried to tell me, "Well, that's just your belly button was always off centered." And I was like, "Oh, like I don't have a million progress pictures of my weight loss. My belly button was never off center. It was always in the middle." So I shut that down pretty quickly and he was like, "All right, I'll fix it." And I'm like, "Well, yeah." So he schedules an appointment to fix that part of the surgery to get my belly button over in the middle. So he says it's going to be an in office procedure, which I thought was interesting. So I go that day to that appointment, and yeah, he does not put me under anesthesia at all. He just gives me a couple of numbing shots and then proceeds to do this mini surgery to fix it. And it is so uncomfortable. It wasn't painful because he did numb the area, but there's a lot of pressure that you feel from him like tugging things that I absolutely did not care for. So anyway, he gets the belly button to be better, but still not perfectly centered. And he told me once all the swelling and stuff went down, it would be centered. So I'm like, all right, I'll see. So about 3 days later, that belly button is now clearly infected. So I have to call him, schedule another appointment. He gives me some antibiotics. It's still not really getting any better. He has to do another minor surgery on it to clear out whatever infection, try to move the belly button over a little bit more. And now it's almost perfectly centered, but it still to this day is a little bit off, like slightly. So anyway, that heals up. And throughout this whole healing process, I have a lot of swelling, and just because of gravity, all the swelling goes down to your feet. And I remember my feet were so swollen, like they look like bricks. But yeah, for me to be fully okay again, to go from being able to walk on my own, lay down and get up on my own, do everything by myself again, I want to say it was about 6 weeks before I didn't depend on Steve for anything. Each week it got better and better and easier, but yeah, I wasn't back to normal till about 6 weeks. And then I wasn't able to go back to the gym for about 3 months. I remember I tried at month 2 And as soon as I did any kind of resistance training, it really did hurt the inside of my body. So I decided to stop and let my body finish healing before I went ahead and did that. It took about 2 months for the swelling to go away, and then the scar to get to where it is now, which is pretty light. That took about 6 months for it to like not be dark or purple or anything like that anymore. Now it's just skin color and it kind of just blends into the rest of my stretch marks. I also had a lot of bruising right after the surgery too, especially in my back, which I'm not really sure why, but I know that they can be pretty aggressive when they're in there doing the surgery. And all of that, went away in the coming weeks as well. So, even with my experience, which I don't think was the best and I do not think is the norm, but even with them rushing me out of the hospital, even with the excessive pain, even with my belly button being crooked and then getting infected and then having to go under like local anesthesia to fix things, and even with me taking so long to heal, was it worth it? I would say, yeah, yes, absolutely, because it did wonders for my confidence. I was able to go a whole dress size smaller just simply because that skin wasn't in the way anymore, taking up space. So if somebody from the future had come to me and been like, hey, Zoe, you're going to be okay, but your surgery is going to be really, really rough and you're going to have a really hard time recovering and it's going to be super painful. And also your doctor is going to kind of mess up your belly button, but then don't worry, he'll fix it. But it's going to be kind of dramatic and emotional for you. Do you still want to go through with it? I would have said yes. Like knowing what I know now and going through all of it, yes, it was still absolutely 100% worth it to me. Now, I did have a friend who got the exact same surgery as I did. She didn't go through a big weight loss, but she did have 2 kids and had loose skin from her kids, and she wanted to get that all cleaned up. So she also had the same thing, breast augmentation, and then the excess skin removed from her stomach. And she did have to have her the abdominal wall sewed back together as well. And she was fine after 2 weeks, like zero complications, healed super quick, no problem. So just because I had a hard time doesn't mean that you would have a hard time. But my recommendation, just from my experience, is number one, make sure you have somebody that you can rely on, that you can count on to help take care of you when you need it. Number two, I would say take at least 3 weeks off of work to heal, but set the expectation that you might need more depending on how the surgery goes. And then even when you get back to work, you're still not going to be 100% yet. So just kind of setting the expectation that this is a big surgery and you are going to need sufficient time to heal. Now, I do still have quite a bit of excess skin on my arms and legs because I never had that surgically removed. I never had him touch my arms or legs. And it does still bother me and it does still kind of mess with my confidence. Will I get that surgery done? I don't know. I think one day I might, but I'm still not 100% sure. Number one, I just don't feel ready yet to go through another surgery and to recover again. And number two, while it does still bother me, it is not as much of a confidence breaker as my stomach was. Like if I'm just standing in a bikini or something, when I had the excess skin on my stomach, it was very clear. But if I'm just standing, unless you're really looking for it, you don't really notice the excess skin on my legs or arms until I start moving. Then you can really see it, but I just don't care as much. So while it does bother me and I wish it wasn't there, right now it doesn't bother me enough to go through with another surgery. So obviously, I'm not a doctor, not giving any kind of medical advice, but if you are somebody who has gone through a sufficient weight loss and you're thinking about a skin removal surgery and you're wondering if it's right or not for you, and you're wondering if you should do it or not, and you're wondering if it's worth it or not, number one, find a doctor you trust and talk to them about your options. But honestly, it really was worth it to me. It did wonders for my confidence. And I am really glad that I did it. Even though I had a harder time than most people, I am so happy that I decided to go through with it and get that surgery done. So I hope this story was helpful for you if you are somebody who is thinking about getting this type of surgery. If you have any questions at all, please let me know in the comments down below. I will absolutely respond to each and every one of them. I showed my scar in a previous video. I think it was my what I eat in a day video, and I was also like answering questions and somebody wanted to see the scar, but I'll show it again right now. It is super, super light. Okay, I'm just going vlog style here, but there's the scar, and you can see I have so many stretch marks still, but the scar starts right here, and it's so light and thin, but it just goes all the way across the bikini line to this side, and it ends right there. So when you're wearing a swimsuit, no one can see it. Nobody will know. So yeah, as you can see, the scar is no big deal. It just blends into my stretch marks anyway. Nobody ever notices it. And I would much rather have this big long scar than have all the excess skin that I used to have. Thank you so much for watching. If you found this video to be helpful, please subscribe to my channel down below and give the video a thumbs up. It means the absolute world to me. I hope you have a fabulous rest of the day, and I will see you in the next video. Bye.